Functional hallux limitus is an entity where the first MTP joint has normal range of motion during clinical examination, but when the joint is loaded, there's no dorsiflexion range of motion available. No matter how hard you press, it won't move. But as soon as the thumb comes away and the first metatarsal is allowed to plantarflex, MTP joint motion returns to normal. When the MTP joint is straight, the foot is mushy on exam. There's no structural stability to it. However, when the joint is dorsiflexed, there's a lot more stability available. So the key is to make this joint bend. The Dananberg Vasili orthotic was designed to allow for different size cutouts underneath the metatarsal head depending on the size and shape of the individual's foot structure. So the orthotic is placed on the appropriate size, and the metatarsal head is identified. The plug that's removed is the one that's directly under the metatarsal. So in this case, it would be the proximal plug. And we look and see where the metatarsal head is, which is right here. And now, even with load, it'll easily dorsiflex into that space. In certain types of feet, though, and I'll just move the orthotic to show you, there are long first metatarsals. So if that's where the metatarsal head was, then in that case, the distal plug would be removed. The proximal one would be left in place, and then that would be in the right location. The last thing that we could do is also, if the metatarsal is sort of in between the proximal and distal, then that could be taken out. The proximal plug can be taken, turned over, placed in the space, and then the adequate size cutout developed.